So good morning, everyone. I'm Imani, and today I'll be presenting with Rihanna Solomon and Ronette Armstrong on Pompe disease. So first, a quick overview of what we'll be talking about. I'll start with the introduction, and then Ronette will go into the genetic onset, the clinical presentation and symptoms, and statistical prevalence. And then Rihanna will finish with diagnostic testing, treatment, and a little surprise at the end. So stay tuned. So first, what is Pompe disease? So as it is a genetic disorder, we saw it fit to start with the gene. So Pompe disease is a very rare disorder that is characterized by insufficient amounts or low activity of an enzyme called acid alpha glucosidase. This is caused by a mutation in the acid alpha glucosidase gene, which has its gene loci on chromosome 17. Based on its loci and the fact that a defective gene needs to be inherited from both parents, Pompe disease is characterized as an autosomal recessive mutation. So there are over 600 genetic variations of the gene that have been associated with the diagnosis of Pompe disease. Therefore, how deficient you are in this gene would be based on the variations you get from your parents and their combined effect. So now that we understand the gene, we can move on to the enzyme. As it would make sense, the GAA gene codes for the acid alpha glucosidase enzyme or protein. The enzymatic function of this protein is that it breaks down glycogen in the lysosomes of hepatocytes. So looking more at the lysosome. So what exactly happens in the lysosome? So the lysosome, as we know, is known as the recycling center of the cell. It is the organelle that is responsible for breaking down old or misformed cell contents into smaller molecules so that the cell can reuse them. So what also occurs in the lysosome is glycogen breakdown. And acid alpha glucosidase is actually one of the hydrolases that is responsible for this breakdown. As we know, glycogen is a multi-branched polysaccharide of glucose that serves as a form of energy storage in the liver of animals. So because glycogen is broken down in the liver, hepatocytes have an abundance of lysosomes to facilitate this function. In the case of Pompe disease, where the GAA gene is mutated, there would be a deficiency in the acid alpha glucosidase enzyme. This would lead to major lysosomal dysfunction, as the deficiency in the enzyme would lead to the reduced breakdown of glycogen in the liver. If glycogen breakdown is reduced, glycogen would build up in the hepatocytes. And as we know also, glycogen buildup is often toxic to our cells and leads to many physiological disorders, such as an enlarged liver. It would also, of course, lead to less liberated glucose, which would mean that glucose metabolism would be reduced. As we know, glucose is a major component of cellular respiration for energy production. Therefore, reduced glucose breakdown would lead to low or inadequate levels of the cellular energy in the form of ATP. Glycogen buildup in the liver and low cellular energy would be the major causes for the symptoms associated with Pompe disease. Now, Ronette will go more into those symptoms and their onset.
Okay, to remind you guys about what Pompe disease is a genetic disorder where glycogen builds up in the cells of the body. Pompe disease is a result of a deficiency with respect to an enzyme which is commonly known as acid alpha glycosidase or GAA, which is responsible for the breakdown of complex sugars like glycogen, as Imani mentioned previously, in the body. This buildup of glycogen usually occurs in the tissues, organs, and muscles. When a mutation occurs in the GAA gene, this disorder is the end result. Pompe disease has three main types, which vary depending on the severity and the age at which the symptoms occur. These types are classic infantile onset, non-classic infantile onset, and late onset. The types of Pompe disease will now be further discussed in detail. Classic infantile onset usually begins a few months prior to birth The infants experience a number of symptoms, some of which include muscle weakness, otherwise known as myopathy, enlarged liver, difficulty breathing, feeding problems, and problems with hearing. In some cases, however, the infants struggle to gain weight and they do not grow at the normal rate of most infants. Classic infantile onset, if left untreated, leads to death of the infant by heart failure. With respect to non-classic infantile onset, symptoms usually appear by the age of 1, and it is characterized by an abnormally large heart, problems related to breathing, and progressive muscle weakness. In this case, however, death due to heart failure is not likely, and infants only live into early childhood. With respect to the late onset, symptoms are not commonly visible until late childhood, adolescence, or even adulthood. It is a lot milder than the infantile ones. Some symptoms of it include progressive muscle weakness, these are primarily the muscles involved in the mechanism of breathing, the loss of the ability to exercise, and even increased difficulty hearing. Problems with breathing in this case primarily lead to failure of the respiratory system. We will now take a look at some statistics on Pompe disease. Pompe disease affects 1 in 40,000 persons in the US and the Netherlands. The prevalence of this disease varies due to ethnicity, and many experts estimate that 5,000 to 10,000 persons have the disease worldwide, but since it is so rare, the diagnostic process is a challenge for many doctors. Over to you, Rihanna.
When it comes to diagnosis, we usually do a blood test. So we test for creatinine kinase. As in patients who have Pompe disease, their creatinine kinase levels are usually elevated, especially in infantile onset. The CK values are usually the highest, and 95% of late onset has elevated CK. However, the levels of aspartate aminotransferase, alanine aminotransferase, or even lactate dehydrogenase may also be elevated and therefore can indicate Pompe disease, as they are enzymes that are released from the muscles. Gene sequencing is done to test the GAA gene to see if it is mutated. As Imani mentioned, the mutation of such gene tends to stop acid alpha glucosidase from breaking down glycogen, effectively resulting in the buildup of sugar. Electron microscopy is another form of diagnosis, as glycogen builds up in the lysosome and causes structural features to be seen. Electron microscopy can be used. This is usually utilized in prenatal diagnosis as well. We can also do a pulmonary test to test the lungs' capacity, ensuring it is optimal. Electromyography is used to test the muscle to ensure they work properly. X-rays and electrocardiograms are used to test the heart to ensure it's functioning and that there isn't any abnormal enlargement. There are many cases where Pompe disease was misdiagnosed, as some of the symptoms align with other common diseases. For example, a lady who experienced late onset simply started off by having headaches every day. For a while, the doctors didn't know what was the cause of this, and as it progressed, muscle weakness was observed, and she was then diagnosed with inflammatory myopathy. And for 10 years, this lady thought that was her issue until it started to progress and get even worse. She was then finally diagnosed with Pompe disease. When it comes to treatments, enzyme replacement therapy, which is done intravenously using the drug L-glucosidase alpha, which is an enzyme that is genetically formed to act like the naturally occurring acid alpha glucosidase enzyme. We also have supportive therapy such as mechanical ventilation, which is utilized to help the patient to breathe as their lungs may have failed. physical and occupational therapy to help with walking and doing fine motor skills that may have been affected by the disease, as muscles are crucial in movement and performing everyday activities. Placement of feeding tube as the person may lost the ability to swallow. There are many other supportive therapies available for persons whose bodily functions has been compromised. As Pompe disease is a rare genetic disorder, clinical trials for treatment is not only expensive, but there would be difficulty in finding participants. This makes the treatment of Pompe disease ongoing. Now we have a quiz, right, for the main takeaways. So first question, which metabolic process is most decreased as a result of Pompe disease?
Can I go?
So go right ahead.
Is it glycogen breakdown?
Yes, it is. Question 2. Which internal components are mainly affected by Pompe disease?
I'll go. The liver, muscles, and the heart.
Yes. And lastly, what are 2 forms of treatment for Pompe disease?
I'll go.
Mm-hmm.
Would that be gene replacement therapy and supportive therapy?
Yes, both of you will get virtual candy. This comes to the end. This basically concludes our presentation on Pompe disease. Thank you so much for listening. And here we have a page of our references.